Good afternoon. Thanks for joining us today. So today's event is hosted by the Ontario Community Services Coalition, which we refer to as OCSC. And OCSC is a group of families and agencies that started in 2011, and they share a common purpose, which is to ensure that the voices of individuals and families are heard across all of the sectors. Since our inception, which is now 10 years ago, we've had the pleasure of hosting several forums and educational forums on topics that we found have been of interest to families and individuals and to agencies. So today we're very happy to have Dr. Faisal with us and hope that you find his presentation informative, and we look forward to hearing any questions that you might have at the end.
Fantastic. I think I'll take it away, guys. Welcome, everyone. I really want to thank Leslie, Amanda, and Linda for inviting me. My name's Faisal. I'm a physician at University Hospital at London Health Sciences Center. I'm a kidney physician by training, but I'm also the site chief of medicine. So I was in part responsible for managing the COVID-19 situation over the last year at our site. So what I was hoping to do is to just go through a brief presentation about COVID-19 and about the vaccine. And then after that, really leave the majority of the time for you guys to be able to ask questions. So I will now start by attempting to share my screen. All right, so hopefully you guys can see these slides. So today we're going to talk a bit about the COVID-19 virus and vaccination. And what we're hoping to do is we'll review how the COVID-19 pandemic is different from other outbreaks that we've had. Illustrate the importance of social distancing and wearing masks, and understand how medicine can take advantage of viral biology to help develop a vaccine. So this is what the coronavirus looks like in 2 dimensions. And the reason I want to show this is we target the structure to be able to try and find a treatment for our patients who are prone to getting this infection. And so you can see here in the kind of the green, light green color, you have the cell membrane that surrounds the viral particle, or the RNA, which helps transcribe various proteins that are important for the virus to function. And on the outside, you see these dark green spikes. These spike proteins are very important for the virus to be able to attach to cells and then infect them. And so I don't want you to forget these spike proteins, because these spike proteins are what we target with a variety of our different vaccines. So coronaviruses are very common. All of us have been infected with coronaviruses in the past. These are viruses that just cause the common cold. But there's certain variants that have wreaked havoc in the past. And some of you will remember the SARS outbreak. I think that happened back in 2001. That was a coronavirus as well. And it kind of put us in a bit of a panic state, as many of you will recall. COVID-19 is another type of coronavirus that obviously has drastically changed the way we live over the last year. And so there are many other coronaviruses out there, but certainly this is the one that we're facing right now has certainly caused us more problems than many of these other ones. And we'll talk about the reasons for that in a second. So let's go back to SARS. So SARS, again, was first reported in Asia back in February of 2003, and it spread to involve more than 24 countries. Many of you will remember in Canada, Toronto was kind of the primary site where we were seeing infections. We had some healthcare providers pass away from SARS, as well as some patients. And but you can see here the total number of cases globally was only around 8,000, and the total number of deaths globally was 770. The case fatality rate was around 10%. So if you got SARS infection, you had a 10% chance of dying, which is actually a fairly high number when you compare it especially to COVID-19, where the death rate is only 1%, right? So, but we were able to contain this virus, and there's not been a reported case of SARS since 2004. MERS, or the Middle East Respiratory Syndrome, is another coronavirus that's even more deadly. The mortality rate's around 20%. But again, even though there was an outbreak, the total number of cases globally was only around 2,500. And the total number of deaths globally was around 858. We look at that case fatality rate of actually it's 30%, over 30%. That's super high. Yet again, we were able to contain that, which is nice. So look at COVID-19. So the very first kind of alert that came out was Christmas Eve, New Year's Eve in 2019, where there was a string of cases of pneumonia in Wuhan, China. And then the first death that was reported from this kind of new virus was on January the 9th. And look where we are just a year and a few months later. It has wreaked havoc throughout the world with millions of people being infected and scores of deaths. I told you guys that the mortality rate of COVID-19 is only 1%, compared to, let's say, the mortality rate of MERS, which is 30%. Yet this one was way more problematic. And the reason for that is it's so contagious. Like SARS and MERS were not as contagious as this one. So we were able to contain those other viral outbreaks. But this virus, almost like you look at the person the wrong way, you can transmit it. So it's much more easily spread than other coronaviruses, which is why it's caused us a lot of difficulties. And the concept of how this virus spreads is through this concept of super spreading. So what happens is, one person gets an infection, and then they're probably not even symptomatic, which is really actually quite a problem. They go to work. If I'm a doctor, I go to the hospital. I work with 10 or 11 other nurses. Then those 10 or 11 nurses take care of 8 or 9 patients each. And before you know it, just within your own contact, you've probably exposed potentially hundreds of people. So this is what really happened with COVID-19 and why it spread so vigorously. We've had a number of outbreaks in long-term care facilities as well, which has really been an issue both in Canada and the US. And there was an outbreak in Kirkland, Washington, which involved 108 residents, 180 staff, and there were 16 fatalities. And similarly in Barrie, there was a long-term care facility there where there was a huge outbreak there as well. So both in Canada and the US, we've had issues with major outbreaks in long-term care facilities. And so when people congregate in close proximity and they live together, those are areas that are at super high risk of transmitting infection, not only to our patients, but also to the healthcare providers and the support staff and the administrative staff that work there. So COVID-19 spreads mainly through droplets, and so respiratory droplets, and that's why appropriate social distancing is so important. If I'm within 1 foot of you and I sneeze on you and I've got COVID-19 and I'm not wearing a mask and I'm in close proximity to you, I have a very high risk of transmitting that to you. And so droplets is how this virus is spread, and the way we prevent spread is by having that 6 feet distance between us, or 2 meter distance between 2 individuals, and wearing masks is super important. And I think Canadians have been so good about adhering to this that we've been able to really control this a lot better than many other countries. Now, one of the things about COVID-19 is you can be asymptomatic, meaning you have no symptoms at all. And in a way that's concerning, because those are the types of individuals who can spread it to others. If you are going to get symptoms, you're going to get kind of non-specific symptoms like fevers. You may get shortness of breath in severe situations, cough. You may get diarrhea. And again, when it's really bad, you actually get full-blown pneumonia in your lungs, infection in your lungs, and you get something called acute respiratory syndrome, where your lungs can stop working properly and you need to be on a ventilator. COVID-19 can be very hard on your kidneys, and as a kidney doctor, I've had to start patients on dialysis because of the COVID-19 infection. And unfortunately, as you know, a number of our patients may even pass away. So what are the risks? The most important risk, irrespective of anything, is age. The older you are, the more prone you are to this infection. And I'm not sure we completely understand why. Let me give you a kind of an example. An 81-year-old woman who's in great shape, is on no medications with no medical problems and runs marathons, compare that person to a 45-year-old kidney transplant patient who has diabetes and is on multiple immunosuppressive medications. Believe it or not, the 81-year-old is at higher risk of passing away from COVID-19. So the biggest risk out of all of the risks is age. So just keep that in mind. Now, definitely, if you have comorbidities like other health problems, lung problems, Parkinson's, dementia, cardiovascular disease, for sure, those patients are a bit more prone to severe consequences from COVID as well. And so if you look at the bottom there on the slide, you can see here that if you're very young, like less than 10 years of age, it's literally, the chance of dying is close to zero. And then as you age, it goes up slowly, right? And when you're between the ages of 10 and 39, it's only 0.2%. If you're between 60 and 70, it goes up to 3.6%. 70 and 80, it's 8%. And when you're over the age of 80, the risk is around 15%. So age is really the most powerful predictor of mortality. Now, here's some myths versus realities that I've encountered that people ask. And so a lot of these things in terms of using hand dryers or UV disinfection lamps or thermal, spraying alcohol or chlorine and all over the place. And these are not strategies that are effective at preventing spread of COVID-19. The most powerful ways you can prevent it is by frequent hand washing, wearing a mask, and social distancing. Okay, so just keep that in mind. Anything else is really not super effective. Your pets cannot spread the virus. Many of us will need the pneumonia vaccine. That pneumonia vaccine is against a bacteria called Streptococcus pneumoniae. So even though if you have the pneumonia shot, just so you know, that does not protect you against viral infections like COVID-19. So that's a separate vaccine that many of us should get, frankly. Very important vaccine as well. Regularly rinsing your nose doesn't make a difference, and gargling with mouthwash doesn't help protect you from this viral infection either. Anything you can eat or put in your diet is of no benefit. Antibiotics don't work against this virus. And really, when you have there's no specific medication that adequately at this point treats the virus. There's a few antivirals out there that have shortened hospitalization stay, but no real treatments that have drastically changed the outcomes. If you have very, very bad lung involvement, you may need treatment with steroids, but that's almost always going to happen in the setting where you're quite sick from the viral infection. So let's talk a little bit about the vaccines now and how some of these vaccines work. So it's pretty cool technology, actually. So remember that spike protein I told you about that hangs out on the outside of the viral particle? That helps the virus attach to cells and cause infection. Well, the two vaccines that were first released in Canada, the Pfizer vaccine and the Moderna vaccine, take advantage of that spike protein. And what it does is this, I don't know if you can see my pointer here, but this RNA inside the viral particle that is spliced, and the part of the RNA particle that encodes for the spike protein genetically is taken out and encapsulated by a fat molecule and other things, and then injected into our patients. And what happens is the patient's immune system cells take up that RNA particle, and those immune cells then start to see the spike protein genetics inside the cell and start to make spike protein on their surface. And what happens is your immune system sees those spike proteins and attacks them and gets rid of them, and helps prevent, if you were exposed to the virus, again, those antibodies that your immune system makes helps defend you against the virus from causing severe illness. And so again, you're using the production of the spike protein within your immune cells to generate the production of antibodies that will protect you from the infection. And so you get, 2 shots separated by a few weeks in time, and it gives you 90 to 95% effective at preventing COVID-19 infections. Now, there's some new vaccines out. You may have heard of the AstraZeneca vaccine or the Johnson & Johnson or Janssen vaccine, which are similar, except they use a virus and a viral particle to deliver the genetic code that makes the spike protein. And then again, you're exposed, your body is exposed to the spike protein, generates an immune response against it, and prevents you from getting infections. So these vaccines are super important in terms of being able to return us to some form of normalcy. So it is very important that we try and get access for our patients. So again, this is a schematic showing the exact same thing I told you, that when you inject the mRNA vaccine into your body, your cells read the mRNA instructions and start building those spike proteins. So these are cells with these spike proteins on the top. Your immune system sees those spike proteins and starts making antibodies, which help attack the spike protein and get rid of it. So that's how these RNA viruses, RNA vaccines are working. Okay. So again, who do we prioritize for COVID-19 vaccination is very, very important. And I think our patients come first. So first and foremost in Ontario, what we did is vaccinated everyone who lived in a long-term care facility, which I think was the right move. And now, as you guys are aware, anyone who's 80 or older is up next for vaccinations, and then it'll be stratified mainly by age. Certainly, we've applied pressure to the government to also cover organizations like PHSS, which take care of our vulnerable patients, to make sure that they're also prioritized for vaccination. And so that's going to be super, super important. These vaccines are safe. The science is sound and has been used for decades, actually, and has been around for decades. And so, we need to be able to get the majority of Canadians vaccinated quickly if we want to return to some form of normalcy. And when you do clinical trials with vaccines, there's a staged process. You test it in volunteers first, and then you start to increase the number of patients who are in these clinical trials, and go through a fairly robust system. And so, the two vaccines that were first released, Pfizer and Moderna, were tested in tens of thousands of patients. And both of these vaccines work on a 2-dose schedule, as many of you know. And you can see in the Pfizer study, there were over 43,000 people who were in the study. And the Moderna vaccine had over 30,000 patients who were enrolled in their clinical trial. And what happened is half the patients got the vaccine and half didn't. And then they followed outcomes. After you get the vaccine, within a week or two, you start to get the protection. So it works fairly quickly, actually, at preventing severe infections. So again, these mRNA vaccines are safe. They don't change your own genetic code. They don't change your DNA. All they do is make some of your immune cells express the spike protein that then is recognized by other immune cells that generate antibodies against the spike protein. So it's very safe. You don't get COVID-19 from the vaccine. The reaction rates have been very low, and it's been very well tolerated. Now, what are some side effects that you can get? Just like with any other vaccination, you may get discomfort at the injection site. You can get fever, headache, and muscle aches. But again, the vast majority of patients tolerate this quite well.